You may have symptoms that could indicate heart disease, and if you do, don't worry, I'm here to help you. My name is Dr. Albizam, and I am board certified in cardiology and interventional cardiology. I have been in practice for over 20 years, and my job is to diagnose and treat heart disease of any type. There are many types of heart problems that can be treated. But first, let's have diagnosis before we start any treatment. And in order to do that, let's start with a stress test that could save your life. Stress tests are designed to evaluate heart muscle under stress. In other words, it is a way of making your heart work hard and fast so that doctors can see how it responds. Stress tests can help find out if there is a lack of blood flow to your heart or if you have irregular heartbeat triggered by exercise. These events may cause symptoms such as chest pain, shortness of breath during exercise, palpitation. You may not have these symptoms at rest, but the problem may show up during exercise. A stress test also might help determine the severity of suspected heart disease before you try exercise program or have surgery. There are several types of stress testing. Stress testing is the way to check your heart function. Stress testing is used to detect problems that may not be evident at rest, such as poor blood flow or irregular heartbeat caused by exercise. The tests involve having you walk on a treadmill while monitoring a record of your heart rate and blood pressure, and take images of your heart muscle. It can help diagnose coronary artery disease, which affect the blood vessel going to your heart muscle. And it is the most common type of heart disease in women over age of 50. The heart relies on a healthy supply of blood to meet its needs for oxygen. Our hearts are not made of stones. They need blood in order to meet their needs of oxygen and nutrition. So when you exercise and your heart rate goes up, the amount of blood that flows through your body increases as well. This helps the muscle get more oxygen during exercise. But if your arteries are blocked or narrowed by plaque buildup, which is definition by the plaque buildup, fatty substance infiltrated underneath the wall, they cannot expand or open enough to let in this extra blood flow, and that can be dangerous when it comes to running, biking, or other high-intensity activities. Stress testing also can help detect clogged artery in your heart before you experience warning signs such as chest pain and heart attack. The heart relies on a healthy supply of blood to meet its need for oxygen. When coronary arteries are narrowed or blocked by plaque, the heart muscle has to work harder in order to get enough blood and oxygen. This can cause chest pain, shortness of breath, or other symptoms may be mistaken for other conditions. You should be tested if you have any of the following risk factors. First and the most important factor is genetics. If your mother and father have coronary artery disease in the age of 50 or less, you should be tested for heart disease. Number two is risk factors such as being a male, age above age of 50, high blood pressure, hypercholesteremia, and diabetes. Many stress tests involve walking on a treadmill or pedaling a stationary bicycle, while the heart is monitored by the EKG. The stress test is a medical test that measures how your heart responds to exercise. It's used to detect coronary artery disease, which is narrowing of the blood supply that supply blood and oxygen to your heart muscle. The test may be also done to detect other type of rhythm problem, such as ventricular tachycardia or supraventricular tachycardia. The stress test may involve walking on a treadmill or pedaling a stationary bicycle while your heart is monitored by EKG or electrocardiogram. If it's difficult for you to exercise, such as because of a knee, hip, or foot pain, you might have a chemical stress testing. This is involved having radioactive substance injection into your bloodstream. The radioactive substance is picked up by your heart muscle, and if there is a problem in your heart, the radioactive substance will not be picked up. The radioactive substance is removed from your body by your kidney within a few hours. If the result of your stress test suggestive blockage in your artery, then the next step needed to be done is a cardiac catheterization, which is a procedure in which a tube is called catheter is inserted into the blood vessel in your groin and threaded up through your artery until it reaches your heart. During this test, dye may be injected into your coronary artery to see whether or not they are blocked. The last thing to remember is that the stress test is not exact science. As we mentioned before, there are false positive and false negative. This means you may have positive results even though your heart is healthy, or you may have negative result even though there is coronary artery disease. This does not necessarily mean the test was wrong. It is just mean it is not always definitive. If you concern about your health, talk to your doctor about any symptoms you are having so they can make sure everything is okay. I'm so glad you are here. If you want to get started on the journey toward a healthy heart lifestyle, now is the time. Don't wait. Make your appointment today. In the next episode, I will talk about lower extremity angiography. Stay tuned for that.